knew you were in there.
Look at how life-changing this technology could be. House Locked In. It's been requested by you. It's one of the best episodes of House of all time. So let's watch it.
Someone talk to me. Hey, you don't hear me talking to you?
Great heart for transplant.
Who?
Oh, what? This patient's clearly awake. Don't transplant his heart. It looks like this patient has locked-in syndrome, and this is exactly why you need 2 doctors to confirm brain death before you can start transplant process. If Dr. Harvester over here bothered to check, this patient should be able to blink and have eye movements to be able to communicate.
Violates certain ethical laws to rip the organs out of a guy who's still alive. Possibly
Thank
certain
you.
law laws too.
Thank you.
Get back in your bed, please, Mr. House.
It's actually Dr. House.
I love that. It's actually Dr. House. It's actually Dr. Mezher. I'm going to use that one day when I've got Karen who's annoying me at some point and mistitles me. Did you know that you can buy a Lord title in Scotland? Don't worry, this video is not sponsored by that company. But maybe I'll do that one day. Actually, it's Lord Mezher. So, in this situation, if he did rip out the organs of this patient, if he had the complete type of locked-in syndrome, then they would not feel pain. If he had the incomplete locked-in syndrome, then he would feel pain. So I would hope for his sake that it was the complete form, although it's less likely to recover from that. So double-edged sword really, but it's also hard to recover when you don't have a heart.
I also know about locked-in syndrome. Things are either involuntary or voluntary. Blink if you can hear me.
I hear you.
He blinked! I knew it! Okay, so that means this is locked-in syndrome. What happens in locked-in syndrome is that you get damage to the brainstem, which is the area of the brain where all the neurons converge to densely packed units. One part of this area is called the pons, another is the midbrain. Both can be affected, and that can cause a lack of ability to speak, to chew, to move your arms, legs, walk, to feel. It really is called locked in because you can still think as you would otherwise with high cognitive function, but you can't confirm that you can think. Some things that can cause this are, the most common cause is stroke, then you've got infection, you've also got drug overdoses, things like cocaine, and trauma is another one, as well as different types of endocrine hormonal problems as well. So that's kind of what I've got on my register right now. You've also got other conditions that cause demyelination, like multiple sclerosis. So let's see what it is here. It's not quite clear yet, but we need more clues. So it does look like this patient has had an accident while on his bike. But if this were caused by trauma, then it won't be reversible. So I hope for his sake that it's not, and it's one of the other causes that's easily treatable.
Square root of 9. You got that faster than you.
I love how House just casually roasts people through the whole series. Like, this is how hospitals were in the good old days. But now that's what we call harassment. House. Not okay. I think that's for the best though, since what some people find funny, then others take offense to, and you know, that's fine if you're working in a comedy club, but when you're in a hospital, you need a cohesive team, although we do have a lot of drama in the hospital as well.
Lee, hit the brake, hit the brake, hit the brake.
You sustained a traumatic injury to your brainstem.
Oh, this is getting spicy. So it seems like the paralysis happened before the accident. So that doctor really needs to keep up. I got that like 3 minutes ago. It's not a traumatic injury to the brainstem.
An MRI showed a lesion in the central pond. See it there? Means no way head trauma did this. It's cancer causing a paraneoplastic syndrome.
Ooh, paraneoplastic syndromes. So that's one of the things doctors get very excited about. It's when basically you have distal effects of cancer without the cancer spreading. So cancer leads to activation of the immune system or release of bioactive substances. Like, for example, in certain types of lung cancer, like squamous cell carcinoma, you get release of protein called parathyroid hormone-like protein that activates receptors to trick them into thinking that parathyroid hormone levels are high, and that releases lots of calcium. Not so relevant to this case, but what's more relevant is there could be something like Lambert-Eaton myasthenic syndrome, which is where the body produces antibodies to some of the tumor antigens, which are basically like the flag molecules on the tumor cells that are being attacked by these antibodies, and then they cross-react with the body's nerves, causing damage to them and leading to paralysis. Now, it would be exceptionally rare for that to affect the whole body, but let's see. House is known for giving rare things.
You're a good guy. Easy to talk to.
What's happening to me?
Need some help in here? Your patient is seizing.
See, seizure is caused by disruption of electrical activity in the brain. At this point, the patient, they thought, could have some form of infection, so they gave antivirals to him. And yes, it could be because of the antivirals, or it could also be like a damaged area of the brain that has caused it, or a salt imbalance in the blood. So I'd want to wait and basically see, does the seizure terminate by itself within 5 minutes? If not, I would give anti-seizure medication like midazolam, and the blood tests and a brain trace with EEG would be really important.
My turn.
It's cancer.
No, it isn't.
Yes.
Small tumor in his brainstem causing paraneoplastic syndrome. He needs plasmapharesis.
See, plasmapharesis is quite an interesting technique. To explain it, you need to know what blood is made of. It's 45% blood cells, but 55% plasma. In plasma, that's your body's antibodies, some hormones, cytokines, and in paraneoplastic syndrome, those hormones, cytokines can be the things that are causing the issues. So what happens is the machine takes your blood, spins it to separate it into the different components, and then takes the blood cells and flushes them back into the body in fresh donor plasma, essentially discarding the body's own plasma so that it can heal the body from the antibodies that are abnormal. Usually any benefit is literally only transient, so we don't really do it anymore because it doesn't really give a significant benefit. But it seems like, House just wants to make it seem like he knows what he's doing, and he wants the patient to be transferred. So that's probably why. I don't know if he's actually going to do this.
Instead of talking to him, we talked to the lesion.
Talk to me.
We're going to biopsy the brainstem?
For the record, that doesn't count as your inspired idea. It's sort of where I was heading.
Oh, okay. So they abandoned the plasmapharesis idea. It does seem like he just suggested that to make it seem like he knew what he's doing when he actually had no idea. And now they want to biopsy the brainstem. So if you don't know why I'm screaming at that, it's because it's crazy. The biopsy is so you can get a small piece of tissue and look at it under a microscope and see what kind of problem it looks like. Because each type of condition in medicine usually has a specific signature that you can see on a microscope. So when you go into the brain with a needle into an area that's densely packed with nerves, then there is a very high chance that you can cause damage. And this patient has very little residual function left. He's able to blink, he's able to move his eyes, he's able to see, he's able to hear. Ridding him of his ability to do any of those things would be horrendous, but also would be horrendous if he had a curable condition and they didn't figure it out. So why not? Go for it.
Look at me, Lee. Again, is more than half of this circle shaded?
Blink. Come on, Lee. Blink.
Back out.
See, that is why when you're taking biopsy from a dangerous area, you want the patient to be awake so you can test if you're going through an important area before any nerve damage actually comes along. You might ask, could that be painful, being awake while someone's got a needle stuck in your brain? But interestingly and ironically, even though the brain feels all pain, it cannot feel pain directly because the brain senses pain through receptors called nociceptors, and the brain itself doesn't actually have any. So you might ask, well, what about when you have a headache? You still get pain in the head. Well, that's not the brain itself. It's actually the structures around the brain, the meninges, which have the pain receptors. So those areas that have the receptors and the scalp would be injected with local anesthetic when the cut in the head would be made to try and make it as comfortable as possible. And then once they're inside the brain, then no anesthetic is actually needed. Quite interesting. Let's see, hopefully he doesn't lose any of his residual function permanently and they manage to catch it in time before the worst has happened.
Brain biopsy reveals severe damage to the myelin sheath. The question is why?
Oh, that's interesting. So demyelination is the loss of nerve insulation. You can think about it like if you've got a wire, since the brain is a bunch of nerves similar to those wires, the inside conducts the electricity and the outside insulates it. Losing myelin is like losing the outside plastic layer of the wire. So, you may have seen it if you've got an iPhone and had it for a few years, where you plug the charger in, sometimes gets a kink in it, and then the electrical wires start to get all frizzy and sometimes can even spark and can end up being broken because of it. In the body, when you lose that myelin, you get degradation of the signal, and so whatever that nerve does tends to not function very well. There are lots of different things that can cause this loss of myelin. The most common is something called MS, multiple sclerosis, which is where your body attacks its own nerve cells. There's also something called progressive multifocal leukoencephalopathy, or PML, which is where you get infection with a virus called a JC virus. That could be the case here, or something called leukoencephalopathy associated with AIDS, which is caused by just a HIV virus directly. Another is something called ADEM, which is where you get acute disseminated encephalomyelitis as a result of a different viral infection like measles, mumps, rubella, flu, herpes. So be careful who you kiss. And there's the last one, which can be an acquired cause of demyelination, is something called central pontine myelinosis, and that's where your body gets used to low salt levels over a long period of time, and then all of a sudden it gets corrected, and those cellular adaptation mechanisms that your brain uses to try and survive with the low sodium ends up leading you to have severe brain swelling and loss of this insulating nerve layer. So at this point, I would definitely be wanting to check for HIV. I would want to be doing blood tests, checking the kidneys, and doing a CD4 count, which is basically to check how advanced HIV is, if it is positive. Obviously, there are loads of other things I would want to do, but just to see which ones of these are more likely or less likely.
Brain-computer interface. The goal is to get you to move that cursor with your mind. Think up enough times, it eventually learns what you're thinking.
Oh, it looks like he actually lost his ability to blink. That's so painful to see. But this brain-computer interface that he's got going on is actually real. You might have seen a Neuralink monkey who was able to basically play Pong with just his mind. It's a growing aspect of medicine, and there are billions of dollars trying to help grow the technology. And so you might see that in the real world, the hats look a lot less cooler than this hat does in-house. It's kind of like a hat with loads of freaky electrodes on it. And because it's outside the head, like on the scalp, the signals from the brain are muffled. It's kind of like if you're hearing footsteps through a closed door, as opposed to being in the same room with the footsteps, which would be the goal. And so that's why there's actually a company called Synchron who is developing a brain stent that can read brain signals from the inside that will be implanted. So in a few years, paralyzed patients will be able to use their literal brain signals to be able to communicate. They already are to a degree in experiments, but it might even be able to be rolled out outside of the experimental phase. Cool, right?
Are you really in there? I knew you were in there.
Look at how life-changing this technology could be. See, this reminds me of a study I read in What We Owe the Future by William MacAskill, a professor of philosophy at Oxford. When asked, is the world getting better? Only 9% of people actually say yes, even though we've had such crazy advances in technology, healthcare, science. Obviously, people are going through a lot of difficult times right now, but technological advancement like this is possible here and now, when previously people with conditions like this weren't able to communicate at all. But it just makes you think that regardless of how much doom and gloom there is out there in the media, the world really is getting better. And this is an incredible symbol of human achievement.
Big step down from running your own business to sweeping up.
Doing what I had to do.
Metal filings, I'd say cadmium.
Heavy metal poisoning explains everything.
Ooh, so Lee, the patient who was locked in, was doing extra shifts to basically try and support his family because his actual business was not running very well. And that's how it looks like he could have come into contact with this cadmium, which is used for batteries that he was sweeping up. And you see, cadmium is a particularly toxic heavy metal. It poisons someone by affecting their body's ability to process something called radical oxygen species. And so as they build up, they can cause damage to DNA and cell death. And so that can lead to basically difficulty breathing, kidney failure, and brain damage by damaging some of the cells that support the myelin sheath, which is the insulating layer around the nerves, and So that could explain what's going on here. If that's true, then giving a chelator binds all of that heavy metal and stops it from affecting the reactive oxygen species pathway, and the patient should improve. But I don't know about it, to be honest, because it just came on a little bit too sudden. Seems like it could be probably something else from our list. I'm still thinking infection, still thinking other demyelinating disorders, potentially electrolyte problems. So we'll see.
Ulcerative keratitis.
Means it's not cadmium poisoning.
Ooh, very interesting. Another clue. So ulcerative keratitis is where you get inflammation in the peripheral cornea, which is basically the outside layer of the eye, except not the circle bit right in the center. It can be caused by local causes, like irritation, dryness, or it can be caused by systemic causes, which are like vasculitis. But then you would expect, yes, he had blood in the urine. He had keratitis. He had the brain damage. I mean, it could cause all of his symptoms. It would be very rare, but in that case, it would be treatable. He would just be given some immunosuppressants and he would recover quite quickly. But one thing that I would want to do is, if you're going to give immunosuppressants, it's really, really important that you make sure it's not infection, because your immune system might be keeping the infection at bay, and as soon as you suppress it, the infection runs wild. And so that's why you would definitely want a lumbar puncture by this point, which is where you get a sample of the fluid that surrounds the brain, and you can see from there, if there is any infection in the brain, and if there is, then what type. So I'm surprised they haven't done that already. That would be one of the first things, if he went to an actual A&E, that they would do.
LP stands for lumbar puncture. We use this needle to collect fluid from your spine.
Right on cue. Could I have mentioned that at a more perfect time? Please, come on, just for that, you're gonna have to subscribe. So I'll take that. I'm gonna start my own medical drama. Do you want to see it? What do you want to see it on? Let me know in the comments below.
Something's wrong.
Into your spine.
Oh, my chest. Something's wrong. I think I'm...
Pull the needle out.
Oh, God.
Watching this happen in real life is so scary. I've definitely seen a few patients arrest. You spring straight into automatic mode and all of your training comes in. There's no time to think. It is a life or death situation, and it's a lot of pressure. Hopefully you get a good outcome. Sometimes you don't, but the times that you do, you're on cloud nine, and so is the patient's family.
Charging, clear. Again, clear. He's back.
No, let me go. Can't fix me. I've been here for 3 days.
See, the patient doesn't want to be alive at this point. Should the doctors be allowed to fulfill his wish if you could communicate it? If they realize that it's likely it would be irreversible? I've had plenty of patients ask me if I can end their lives, especially on palliative medicine, because they were suffering. But in the UK, it's not legal, so of course I didn't. But do you think it should be allowed? Let me know in the comments.
You got the patient's urine on that arm?
When I was putting in the catheter.
You've got a rash. What if it's an infection? If there were rats in that basement, the liver failure could be caused by leptospirosis.
Oh, that's not realistic. Okay, so now the patient has liver failure. You would know about it earlier because his eyes would be yellow and his stomach would be big. His blood test would be totally abnormal with clotting all over, even if it was end-stage liver failure. Second of all, if she were infected with leptospirosis, like he said, then there would need to be a cut on her skin for the bugs to actually get in through. And third of all, if the disease the infection were disseminated enough that it would cause the paralysis at the beginning, then the other features would be there right at the same time. It wouldn't just be the paralysis. Interesting though, I think the condition that they're trying to get at is something called Weil's disease, spelled W-E-I-L, which is super rare, but treatable with antibiotics.
We found rats in your buddy Dave's basement. Tested positive for leptospirosis. Means we're on the right treatment.
Ooh, so if they have got him on the right treatment, then that means he's going to recover soon and he's going to be able to start moving. Gosh, imagine treating a patient like this in real life. How happy would you be if you got that diagnosis? Although you wouldn't have to go all the way to the house, catch a rat, and then test its urine, which seems like is what they've done here. That's commitment. If a doctor does that for you, they have earned their retainer.
Concentrate. Move one finger for me.
Oh, 65% of people with locked-in syndrome don't recover any motor function at all. And he has managed to do it. Amazing. He's back again. What a story.
God sent you.
Suddenly, you're not so fascinating.
That is so funny. It does raise an interesting question. If you have a 10-hour operation and your surgeon fixes you, was it them or God? Or both? I guess everyone's views are different. Whatever you believe, go check out another episode right here. I'm Sermed. Until next time, stay curious.